Hey everybody, I'm Dr. Emily Schaheen and I am an orthopedic hand and upper extremity surgeon with Northeast Georgia Plastic Surgery. And today we're talking about an injury that I've seen a lot of this summer, which is extensor carpi ulnaris tendon instability, or also sometimes people call it snapping ECU. And typically this can either be a traumatic injury where the tendon that runs along the dorsal and ulnar side of the wrist, which deviates the hand ulnarly, can become unstable. So normally it runs in a little groove along the bone with a thick ligament that makes a little tunnel and keeps it put during all the motions that we do, such as rotation, flexion, extension of the wrist, and so forth. But in cases of instability, the tendon can move outside of the groove, which causes significant pain, tendinitis, and it can also affect people's motion and cause difficulty, particularly with rotation. Treatment options for this, we usually, like everything, start with non-operative treatment, and this looks like immobilization, rest, sometimes bracing, occasionally steroids or other anti-inflammatory modalities can help. If this persists after the non-operative options, we may think about surgery for people. This does require some post-operative splinting and therapy, but typically is a very successful procedure and people ultimately return to their normal activities once they're completely healed. So if you have pain on the pinky side of your forearm or your wrist, particularly with rotation, or you feel kind of a snapping sensation of the tendon when you do those things, come see us. You know, it could be something else, but if it's this specific condition, we can kind of get you on the road to recovery.